Good afternoon, everyone. I'm Governor John Carney. It's good to be with you again. Thanks for joining us for our press conference to give you an update on Delaware's response to COVID-19. We did these press conferences on a weekly basis for, the better part of a year. And as things got better in the summertime, we decided to lay off them for a while and just to continue to encourage people to get vaccinated and get information out in a different way. We did want to, as we're seeing a surge in the increased number of positive cases associated with the holidays and the winter months and people coming back indoors, and just to show you where we are today, give you some update on the data so everyone has an understanding of that, talk a little bit about the Delta variant, which is really driving this current surge, and again, the move indoors by folks. We're joined, as we normally would be, with our press conference with Dr. Carol Rattay, who's the Director of the Division of Public Health. Thank you, Dr. Rattay. I don't know that you ever imagined that you'd have to do something like this when you decided to seek a career in public health, but you've been a great leader in the division there, and I know your people continue to work hard. AJ Shaw, the Director of the Delaware Emergency Management Agency, who's shouldered so many responsibilities across the board, and is our point person on emergency response, vaccinations, testing, and the like, again, with a great team of folks backing them up. And in particular, special notice to the pharmacies and the hospitals who continue to come up big, particularly the pharmacies with their vaccination efforts. We'll talk a little bit about that later. Pam is with us again as well, our sign language expert for the deaf and hard of hearing. We're going to start out, as we normally do, by reviewing the data. I do want to kind of go over that data to just show you where we've been. You'll see as we look at the hospitalization numbers, here's the data update on the board. We're up now on a 7-day moving average. That number of positive cases jumps up and down, mostly up in recent days, but now it's approaching 600. To give you some idea, when we stopped doing our press conferences in late summer, we were in the 20s in terms of new positive cases on a 7 day average. So a significant uptick. It started to increase really after Labor Day in early September, and we were in the 350 to 400 range and continue to tick up from there. Percent positives, if you'll remember, we're always looking for our goal of being under the World Health Organization target of 5%. We're up at 8.7%. And part of that is the fact that there's less testing going on. And we'll see that from AJ's presentation a little bit later. And so if you have fewer tests, you're going to have a lower denominator to bring back your memories of fractions in middle school. And so that number is going to go up. But obviously, you combine it with the uptick in positive cases, and there you have it, 8.7%, almost twice what our target is at 5%. Like I said, we were in the 1% to 2% range back in the summertime when we hit our summer low. The one number that I increasingly mentioned and we track very vigorously is the hospitalization number, for lots of different reasons. Number one, we know it's not a function of testing rates, because these are individuals who have been tested, they're in the hospitals, they're under critical care, which is why they're in the hospitals, or they're under hospital care. We have 34 of those 296 that are critical condition. This peak, and we'll see that in a minute, we're going to show the roller coaster back in January of last year. We hit a peak of 474. But there's a big difference between the 296 today and the 474, and that is that back then we had fewer people in the hospitals because the hospitals were managing their in-hospital census by curtailing voluntary surgeries and other purposes. We had lots of sectors of our economy closed down, and so there was less travel on the roads, less injuries, fewer people going into the hospital. And so at 296, it's probably much tighter for hospital capacity, and AJ will show you some of those numbers a little bit later, than it was back in January at 476. And so that's an important thing to think about. We went off the day, you can see the roller coaster ride that started again as the holiday season of last year of 2020 after Thanksgiving and the run up to the peak there in early January after the December holidays. And then as we improved through January and February, we started vaccinating Delawareans. And so a very different circumstance with that peak in January a year ago than what we're seeing now. We had a little uptick in April. And then, of course, the summer months came and we hit lows over the summer where we're in the 20s in terms of positive cases and very low numbers in terms of hospitalizations. And then we had a run up which started a little bit late summer into Labor Day and then Halloween. We peaked again in September there and with a little bit of a downtick. And now after Thanksgiving, as we started to move into the December holidays, people moving back indoors, it's cold outside, people are circulating, a lot of people vaccinated, but not taking the precautions that they were before because they are vaccinated and there is a greater comfort level there. But we need to stamp down this surge that we're seeing, keep our families safe. Let's look at the vaccine update. You can see we've delivered almost 1.5 million vaccines, and that's really a tremendous thing by all the public agencies, our pharmacies, our hospitals who've administered those vaccines. We've got almost 62% of Delawareans fully vaccinated and moving up at 602,000 fully vaccinated Delawareans. You'll know that our total population is about 950,000, closing in on 1 million people, so you can do your math there. Here's the breakdown under that. The percentage of Delawareans 5 years and older, 12 years and older, 18 and older, and 65 and older who are fully vaccinated. So at least two shots. We'll talk about the boosters in a minute. But those vaccination rates are not even among various age groups. And you can see here with this chart, fully vaccinated rates by age group, that young adults 18 to 34 are really kind of under-vaccinated at rates just above 50% or lower than 50%, particularly in Kent and Sussex County. Some of the racial and ethnic subgroups there, even lower vaccination rates. And so in these subgroups, with the lower vaccination rates, you're going to see a greater risk of spread of the virus, and that's what we're seeing, as Dr. Rattay will report to. Those of us who are 65 and older, we understand the risk. We want to live longer. We want to protect our families and people that we come in contact with, and the vaccination rates are extremely high. Here we have fully vaccinated rates over 90%. The leading county there over 65 is 95% down in Sussex County. Many subgroups are eligible to be vaccinated or to be boosted and recommended by the CDC and our public health professionals. We're not doing as well with boosters. I got my booster a couple weeks ago to demonstrate that this is a good thing for all of us to do. It'll give you extra protection. We have some data that demonstrates that with respect to the new cases and hospitalizations that we're seeing there. So here are the percentage of the population that have received their boosters, again, 65 and older, about half at 50%. Need to move those numbers up, not as high for others that are eligible, 18 and over and 15 and over, but you see the percentages there. What it really boils down to as we move into the holiday seasons now, wear a mask. Wear a mask when you're indoors. Wear a mask. We're strongly advising when you're indoors and in crowded spaces to wear a mask. Obviously, can't wear a mask when you're eating in a restaurant, but wear a mask when you're not. Make sure that you're wearing masks if you're in Obviously, if you're in schools and public places, public buildings, you're required to wear a mask, or children in schools are required to wear a mask, and we see very little spread there in schools because of the mask wearing. But now as we think about what we can do, and think about the effects, right? Our hospital workers, our nurses, our first responders have really been stressed over the last almost 2 years now, 20 months, with the treatment of patients with COVID-19. Our emergency rooms have been full. Our hospitals are treating these patients. We've seen over a couple thousand Delawareans who've passed away from COVID-19. We all know somebody like that, and they're not just all very old seniors. We just had a really well-known and well-respected state employee, just a tremendous state employee, passed away, very healthy guy, and just so sad for his family and for all of us. And I know all of you have experienced the same. So there's some easy things that we can do. Just be conscious of the fact that there's a lot more spread in the community. Wear a mask when you're indoors, get vaccinated, and get boosted. We're all going to be better off if everybody gets their vaccination. We have high vaccination rates that served us well. We need to get more people to get those shots. Get your second shots if you've only had your first. Pharmacies is the best place now. Everybody has adequate supply. Sometimes you've got to get an appointment to get your vaccination or your booster. But and a lot of people haven't received their booster, now's the time to do it. As we move into the holidays, where we're going to be closer at getting together as families with our holiday celebrations, our holiday meals, our holiday parties. Wear a mask when you're indoors, get vaccinated, and get boosted. And again, the best place to do that is at your local pharmacy. We do have Delaware Division of Public Health clinics that are doing it as well. And we would recommend that you contact one of those in your neighborhood if that works best for you. Dr. Karawate, again, as I mentioned earlier, our director of the Division of Public Health and the leader of our public health team, is with us again today, and she's going to drill down a little bit into these numbers, give some advice and add some science to the presentation of the data that I've just made, and to reinforce the recommendations that we're bringing to all of you this afternoon. Dr. Rattay.
Thank you so much, Governor. So as you mentioned, our case rates and our percent positivity as well as hospitalizations have increased in Delaware. Now this is a Delta surge. So the majority of the cases that we sequence are Delta. So we are still dealing with this contagious Delta variant. And in fact, we saw a nearly 50% increase in cases in the last week. Interestingly, for a change, the age group that had the highest case rates was the 35 to 49-year-olds. For the last few months, the highest case rates have been among school-age population, 5 to 17. Prior to that, it's been the young adults for a while. But statewide, as well as in Sussex, it's the 35 to 49-year-olds who have the highest case rates. But really, we're seeing high cases throughout the state. In fact, I normally start with an area of concern map where we use the same criteria most of the past 20 months, looking at zip codes with higher than 250 cases per 100,000 people, a high person positivity rate of 15. And when we use that now, we see almost all of Delaware lit up and meeting that criteria, with the exception of Greenville and Bethany Beach. So I'm going to show you a slightly different picture today, adding an additional filter onto that, looking at the zip codes that not only fit those areas of concern criteria that I just mentioned, but also the areas that have a test-based positivity rate that is higher than 10. And this would indicate that these are areas not only with higher infection, but also lower testing. And so that's the map that you see on the left. If you look at the map on the right, you see the zip codes that we're considering the zip codes with the lowest vaccination rates. That means they're 10 percentage points lower than the state average for fully vaccinated persons. And you can see for the most part, most all of those low vaccinated zip codes are the same zip codes that meet that criteria for areas of concern plus high test positivity. And so really what this is, showing us is if we increase vaccination in these areas, we can naturally expect infection rates to go down as well. I know all of these numbers are discouraging to folks, and this is not where we want to be with case numbers at the same level as they were last year. But here's something important. On the next slide, I want to talk about cases by vaccination status. Now, we've sadly hit a milestone number for deaths today with the death number surpassing 2,200. But our death rate has decreased significantly. So the death rate is much lower than it was at this time last year. So 80% of the deaths are among individuals who are not vaccinated. Additionally, 80% of the hospitalizations are among those not vaccinated. And again, most of the cases are among those who are not vaccinated. So this Delta surge is being driven by individuals who are unvaccinated because, again, the vast majority of Delawareans are vaccinated. As the governor said, it's almost 62% are fully vaccinated. So that smaller percent that's not vaccinated is driving cases, hospitalizations, and deaths, which means that the vaccine does work. But we can do something about these numbers. For people who are not vaccinated, they can get vaccinated. For people who are still partially vaccinated, they can get their second dose, and people who are eligible can get their booster. Our highest priority needs to be to get people who are unvaccinated or partially vaccinated protected with the vaccine as soon as possible. So let me shift a little to talk about our pediatric situation. On this slide, you can see the case rates among our children ages 5 to 17 over the past few months. In September, we saw a peak among this age group where we hit a weekly total of about 1,000 cases per 3 weeks in a row. Then the cases began to decrease. However, by late October, cases began to increase again significantly. We've seen about 4,000 pediatric cases since then. And really in total, since this Delta surge began late June, there's been a total of around 14,000 pediatric cases. Now, since early August, the 5 to 11 age group has the highest case rates, which is really not surprising since they've only recently had access to the vaccine. However, the 12 to 17-year-old age group has been in a close second place during this time period. Just one minor point I want to point out is that the last week shown in this graph, which is November 30th through December 3rd, is an incomplete week. Nonetheless, it still has a higher it shows higher childhood case rates than the full week of November 23rd, which again is indicating an increasing trend. I also want to mention hospitalizations. Our hospitalization number for children and youth was highest in September at 53, and it decreased since that time. But unfortunately, with only 3 days of data in December, there have already been 9 pediatric hospitalizations, which indicates that we will likely see a dramatic increase this month if the trend continues. People are constantly asking why we care so much about vaccinating the younger children, and here is why. We know that they have lower rates of death and hospitalization compared to adults, but children can experience severe illness from COVID-19 and can be hospitalized and die. They also can suffer long-term symptoms of COVID. So if you can avoid this infection for anyone, including children, you should. And we must do all we can to protect our kids. And that includes encouraging parents to get them vaccinated. So let's talk a little bit about pediatric vaccinations. All kids over the age of 5 now are eligible for the Pfizer vaccine. It was an exciting day, November 3rd, when the Pfizer vaccine was authorized for kids 5 to 11. It's a 1/3 of the adult dose size, and it's widely available. And it has been now since November 3rd. But our biggest concern really is low vaccination rates among this age group as well as the adolescent group. So among that adolescent group, the 12 to 17-year-old population, they've all had access to the vaccine since May. Some, in fact, the older kids have had access since March. We only have 51% of this age group is fully vaccinated. Meaning many adolescents are still vulnerable to this infection. And after more than a month of access, we have approximately 16% of our 5 to 11-year-olds who are vaccinated. And in fact, this makes Delaware in the lower half of states in terms of vaccination rates for the 5 to 11 age group. And in general, we tend to do really well for pediatric vaccinations. So this is a real disappointment to us. We know that parents have concerns. We're working to address them by distributing educational flyers and other materials, such as those on the right-hand side of the slide, to let parents know that this vaccine is safe. Clinical trials found it to be more than 90% protective in this younger age group against the virus. There's no lasting side effects. Since the vaccine was authorized, almost 5 million children in this age group have gotten at least one dose of the vaccine, and there have been no serious side effects like myocarditis identified. The vaccine will not impact fertility among children, and children who are fully vaccinated do not have to quarantine after they're exposed to someone when they're considered a close contact of someone who tests positive for COVID-19. And that's a real help to parents, kids, and schools. It minimizes disruption to school and to learning. We're working with schools and parent and sports organizations statewide to get this information out there. And parents are encouraged to visit our webpage on the coronavirus site for more information and to talk to their child's pediatrician if they have questions about the COVID-19 vaccine. So let's switch topics to another hot topic right now, which is the Omicron variant. Omicron variant is on many people's minds right now. The presence of this variant was first reported in South Africa, and now there are cases reported in the US, including in surrounding states like Pennsylvania and Maryland and New Jersey. There are no cases in Delaware as of today, but it is really only a matter of time. Our public health lab is sequencing for the presence of the variant, as are some commercial labs. So we have been looking since we learned about the Omicron variant for it. And certainly we will keep doing that. In fact, our team went backwards a month to look at some of the positive test results to make sure that we did not see it. And at this point, we have not found it. Again, we want to stress this is not a time to panic. There's a lot we don't know yet about this particular variant, like how transmissible it is. Early indications are that it moves quickly, but we just don't know for sure. Is it more infectious than Delta? Does it cause more severe disease? Right now, a lot of reports are of mild disease and hospitalizations that are mostly among the unprotected or unvaccinated. But again, we just don't know for sure yet. And how well do the vaccines work against Omicron variant? It will take another week or so for us to get a clear picture, but like other variants, it's likely that the existing vaccines will provide some level of protection, especially against more severe cases. So let's do what we know we can do and what works. So none of this is rocket science, but it is time for us to double down. If you haven't gotten vaccinated yet, now is a critical time to do it. If you have been putting off your second dose, schedule a time to get it now. And if you are eligible for a booster dose of the vaccine, please get one. I'll talk more in a minute about what we know about boosters. wearing a mask when in indoor public settings is really important. Now that we're dealing with this new Delta surge, I can't say this enough. Going into the grocery store, going gift shopping, going to the craft fair, sporting event, concert, holiday gathering. If you're indoors, please wear a mask and socially distance from others when you can. We know space equals protection. Getting tested regularly, weekly, if you are unvaccinated, is really important for identifying infection and reducing spread. And if you have any symptoms or have been exposed, please get tested. And stay home if you have any symptoms of COVID. We're continuously seeing individuals who have symptoms of COVID and continuing to go out there and exposing other individuals. So, if you have any of those COVID symptoms, please stay home, please get tested. We are seeing influenza now. It is active, and we just can't afford the strain on our healthcare system to add a bigger winter COVID surge in addition to the influenza that we're expecting to see increase. So please do all the things that we know stop the spread of infection now to help. So finally, let's talk about boosters. Just 2 weeks ago, the FDA and the CDC authorized the booster doses for those who are 18 and older. And studies show that these boosters offer great immune protection against COVID. Since the boosters were initially authorized, nearly 160,000 Delawareans have received one. And with the presence of the Delta variant and rising case numbers, we need more people to get one. Boosters increase the strength of your antibody response to protect you from the virus and its many mutations. And as I mentioned earlier, vaccines are effective against hospitalization and death, as evidenced by the fact that deaths remain low and that most cases, hospitalizations, and deaths are among those who are unvaccinated. But immunity against just getting the virus itself does wane over time. We want to cut down the opportunity for you to get the virus in the first place. So if you're 18 or older and it's been 6 months since you were fully vaccinated with Pfizer or Moderna, or if it's been 2 months since you received the J&J vaccine, get your booster shot as soon as possible. We're working on a mini campaign at the state level to promote boosters. And last week, President Biden announced a national campaign that is forthcoming. But if you have questions and want more information, visit de.gov/boosters on our website. And now back to you, Governor.
Thank you very much, Dr. Rattay. Thank you for sharing all that information, putting out there the concerns about the Omicron variant, which hasn't arrived in Delaware. At least we haven't detected it yet. It has been detected in other states. This surge that we're experiencing, as you've said, is the Delta variant, and we need folks to mask up when indoors, to be careful with respect to social distancing, and most importantly, to get vaccinated and get boosted. AJ Shaw is with us again today. AJ, I know you've got some important information to share, particularly to put into some context the hospitalization numbers. It's one of our biggest concerns, obviously. We've heard from our partners at the hospitals, the stress that their people are under, number one, and they're having trouble keeping staff on board as a result of that in part, and the higher numbers that now their hospitals have more patients in it for other purposes, and so the surge in COVID-19 doesn't help. AJ, give us an update.
Thank you, sir, and good afternoon, everybody. Kind of to add on to what the governor was just saying, we are seeing increased rise in hospitalization. So we were, 290s coming on 300, very close to what we saw about this time last year prior to vaccinations. And we have two slides here to kind of compare where we were. So this was last year between, I believe, October 1st and the end of December. And if you see that blue and then that orange part of the graph, that was either positive COVID patients or those people that are still waiting for their test results that were in the hospital. It is about 20% of those that were in the hospital last year at this time were COVID patients. And if you looked at those that were admitted, so not necessarily in the emergency department, but those that were admitted for overnight stays or longer stays, we were just under 1,600 individuals across the state in the hospitals. And then if you go to the next slide, this is really October 1st through yesterday, and you'll see the COVID patients is a much smaller portion of those that are in the hospitals. It's almost the same number, 296 versus 313, so off by less than 20 compared to the same date last year. However, it's only about 16 to 17% of the overall capacity of the hospitals. And like the governor said and Dr. Rattay said, there was a lot of delayed care during COVID. There's people that are going back for, procedures, healthcare issues that, were probably compounded by the pandemic. And so it's a strain. So the 454 number that we saw as being, hey, we were able to handle this. The hospitals did an amazing job making sure they can navigate the patients when we were at, mid 400s. That's going to have a much higher strain today on the hospitals than it did earlier this year. And that's what we need to look at. That's what we're worried about. It's not a bed issue. It's not the actual square footage issue. It's really a staffing issue when we talk to our hospitals. You have a overworked labor pool. You have a lot of turnover in some of the facilities because of the stress they put them under. But those there are doing a tremendous job to make sure that they're caring for everybody. We want to do what we can to lower that risk and trying to keep some of these people out of the hospital. It's going to be, watched very closely. We're working on a few other programs to kind of see what we could do to help relax some of this pressure off the hospitals. But the number one thing we could do right now is keep individuals that can get vaccinated, can protect themselves, can protect the healthcare system to do that. So that's kind of the reoccurring message we have of today. So after that, I'm going to go into a little bit of a testing update. Here we have a graph that is, or just some numbers that go through the number of tests we've done for a week. As you see, for the beginning of November on, the number has decreased a little bit. We were in the mid 30s, then a little bit before Thanksgiving went down to the 20,000s, and then we inched back up a little bit last week to the 14,000. To put that in comparison of last year, we did about 45,000 tests a week between Thanksgiving and Christmas. So we're doing a fraction of the tests we were last year. Yes, there's a large proportion of our populations that are vaccinated. However, there's a large portion that isn't, that should be getting tested regularly, and especially if they have symptoms or they've been traveling or something else. So the capacity is out there. We have the same number of sites and actually added a few more than last year. So make a reservation, walk up. There are facilities across the state. Go to de.gov/get-tested. That is updated either Sunday or Monday of each week to show the rotating locations we have as well as the static locations. As well, I just do want to take a minute to plug on the last slide here. We do have some rapid testing available. It's in high demand at 3 sites. The Oxford, the University Plaza Health Clinic in Newark, Blue Hen Corporate Center down in Dover, and then the Georgetown Plaza. So these are 3 standalone facilities that Dr. Rattay's team opened up, I guess, earlier this year. They've been worked with by the Guard, Public Health, and our partners at Curative. They'll do testing there. They'll also do vaccinations. They'll do vaccinations whether you need your first dose, your second dose, a booster, 5 to 11s if you need that Pfizer or the other one. So it's kind of your one-stop shop. Try and make an appointment for the rapid testing because there's a time that goes into that. So, sometimes later in the day, they're unable to give everybody a rapid test, but they could still get the PCR. And the turnaround time with Curative has still been in that 24-hour mark. So it's been very quick and successful. So a lot of options out there for both vaccinations and testing. If you go to the coronavirus website, you can navigate that. Pharmacies, like the governor said and Dr. Rattay said, are still doing a large number of the vaccinations, but we also have the public health clinics there to support people as well. So with that, Governor, I'll turn it back to you.
Thank you very much, AJ, and thank you to Dr. Rattay. I do want to put up one of the graph that we had earlier that shows the roller coaster ride that we've been on since March of 2020. And I do want to just mentioned that where we were last year, we were at this time last year, December 7th of last year, in hospitalizations, we were at 338. And today we're at 296. So we're not as high as we were a year ago, but you can see that we've had a surge that started a little bit earlier this year in the winter. That kind of declined a little bit and now is on the uptick. So really the main message today is that we've got to get more people vaccinated to prevent the continued surging of the Delta variant of COVID-19, anticipating that the Omicron variant will arrive in Delaware at some point. We know we're just on the front end of the December holidays, lots of parties and lots of celebrations coming up. We want folks to think about helping us to protect our hospital capacity, to protect all those frontline nursing and hospital staff workers that have to deal with folks that end up in the hospital, to prevent the deaths that occur to too many Delawareans. And so that's the message today. You can help. Wear a mask, get vaccinated, get your booster, keep your distance indoors with other folks around, observe social distancing, be responsible. We've made it this far. We've ridden this roller coaster here. We rode it up last year at this time. We're on the front end of it. Let's get ahead of it as we move into the latter part of December. So with that, I know we have members of the media who've joined us. We appreciate your reporting over the last 20 months and your presence with us today, and look forward to your questions.
All right, the first question will be from Meredith Newman from the News Journal. Meredith, just give me 1 second.
Hi there, can you hear me?
Yes.
Governor, you are encouraging people to wear a mask indoors. Why not just mandate it, knowing what's going to happen in the next couple of weeks with holiday celebrations?
Well, I think obviously, as I've been saying for some time, it's the best way to do this is to encourage people to take the protective measures. Sometimes you get more pushback by mandates. There are still limitations to what we can do under the current limited state of emergency declaration. So we're just encouraging folks. We like to avoid mandates like that, and the places that I go to, I often see most people wearing masks when other people wear a mask, oddly, and low adherence to mask wearing when others aren't wearing masks. I think if we can get the message out that we're going to see this winter surge as we have in the past, that people will help out and don their mask and help us to prevent the surge from getting out of control.
And you mentioned workforce issues within hospital and healthcare settings. I'm curious how workforce issues might be affecting vaccine rollouts or even testing capacity.
Yeah, I'll ask Dr. Rattay and AJ to comment on that. I don't know that we've seen that. I will say that we have workforce issues across the economy. It's certainly acute in healthcare and long-term care facilities. We've provided additional resources as incentives to attract those workers. We know that they're traveling nurses that are moving around and filling in and getting paid a lot of those bonuses. But it's not just in the healthcare, long-term care sector. It's just about it's hospitality, you name it, it's construction. It's across the economy where the biggest challenge is finding workers. I think the August numbers, national numbers, there were 10 million job openings and 8.6 million people looking for work. And so every industry is experiencing some of that. Dr. Rattay, AJ, on the testing side?
I can speak on the vaccination side the best, where, we have seen pharmacies struggling with their workforce. We have seen pharmacies decreasing their hours of availability. That doesn't mean that they don't have access to the vaccine, but they have needed to shorten some of their hours and some of their amount of time that they're accessible for vaccine. However, they still are doing the vast majority of vaccinations in our state, and we're rarely hearing about people who can't get the vaccine at a pharmacy, but it's possible that it may take a couple of days before you can get scheduled. We're very fortunate that we still have the National Guard helping us out. They've done just an amazing job in our vaccine clinics. The kids love them. They really do a fabulous job. And so for our public health workforce, we've been able to meet the needs in our clinics with the help of the National Guard. And that's for vaccine and testing. And AJ?
Yeah, so the only thing I'll add, I mean, Dr. Tay hit the National Guard point. They have been a great backstop and, force multiplier. Our partner Curative has, I'll tell you, there have been a few speed bumps in the road, and it hasn't been because of labor. It's usually been, vehicle issues, trailer issues, stuff like that, where we've had to, juggle a few too many balls in the air. But when it comes to the workforce, they've done a great job of keeping it at a level to serve the state well. And also they brought additional people on when we started doing rapid testing in a few sites as well to make sure we weren't taking from another effort and really, increase the capacity of the state.
Our next question will come from Joe from Delaware Public Media.
Good afternoon, Governor. Can you hear me?
Yes, Joe, thanks. Mm-hmm.
Is there anything that the state can do to encourage people to get vaxxed or to get their boosters?
Yeah, what we're doing with with this press conference, getting the word out that we have a surge going on. I think it's been a consistent message. When the winter months come, people are indoors, they're closer together, need to be more vigilant in wearing masks, staying out of crowded places, and importantly, get vaccinated. There are requirements to get vaccinated for state employees. You have to prove vaccination status or get tested. Same is true among other employers. I think we found that kind of the best way to do it is try to meet people with where they are and give them a little bit of a nudge with that kind of requirement, not a rigid requirement, but one that has some flexibility as opposed to, just with a strict mandate. There's a lot of difference of opinion, I guess, out there on that. In other jurisdictions, that's the way we're trying to do it here in Delaware.
Governor, if I can add to that, I think one important piece of this is to guide people to carefully look at the information they're receiving. There's a lot of misinformation out there, and we know that it's impacting people's perspective. So we really want to make sure that when people have fears or concerns about the vaccine and the side effects, that they go to credible websites or talk to credible health professionals like their primary care physician or specialists to get good information, because again, there's a lot of misinformation out there that's really swaying people. And we hope that people will really look at the real science as they make their decisions.
With holiday gatherings coming up and the low number of children being vaccinated, is that in any way could affect the mask mandate at schools? I know a decision's coming up in February, but could that be extended beyond that because of this?
Well, again, we hope we're in a position where we can make a decision at that time in a positive way. I asked that the hospitalization graph continue to be displayed there on the screen. I hope you can continue to see it so people can really visualize the surge that we're seeing now. Hopefully we can get over this little spike and continue to push down. We know that it's going to be harder because it's indoors, but I certainly want to get to the place. And by the way, I've been into more schools more recently, and as I tell people all the time, the children don't seem to be trouble at all. In fact, a lot of them have a lot of fun with their mask. I see a lot of school children that work to Warner Elementary right down the street from where I live, and they're actually wearing their mask as they're walking down the street, not just when they're inside the building. So that's a decision that we'll make. Again, it's really an exercise in trying to get people to do something voluntarily that's good for all of us and that protects others, protects themselves. And we know that wearing a mask is the most important. It's really a pretty simple thing. Unfortunately, it's become, a political gesture in some cases, or, a point of, just expressing some opposition to some of the decisions that we've had to make. It's really simply just keeping others safe and pushing down that surge that we're seeing on the screen and that we saw last winter. We've got vaccines, we've got availability of masks and mask wearing, and we know that they both work. Let's just do them and protect our economy, protect jobs. I was in a small business owner's business yesterday, and he's struggled. He's used some of the assistance. In some ways, they've had a surge. Now they're having difficulty getting some product, and we just need to be in a position where our economy can return to a normal state. And there are lots affecting that, people, labor not being available and all of that. And we just, so getting people to do these things voluntarily, I think, is the best way to do it.
Our next question comes from Tiana Sermons from Light Screen and Action.
Hello, I'm Tiana Sermons, and yes, I'm a youth reporter in Delaware, and my show is Light Screen Action. And my question is, so a lot of times when I'm telling my classmates, I actually am fully vaccinated now, as in this past Saturday, and I told them about my experience getting it, and a lot of them were saying how they were scared to get it, or they didn't know what would happen afterwards from different stories that they would hear. So what advice would you have for them on some of the positive or benefits of actually going to get the vaccine?
Well, first of all, thanks for joining us. Thank you for your continued reporting. I think you and I've met a while ago. That's a great question. And frankly, your reporting can help us get the real information. Dr. Rattay just referred to it a minute ago. I'm going to turn it over to her, but I think it really just boils down to getting the real science and the real information in front of your friends and other students. Dr. Rattay?
Yeah, exactly. I mean, the benefits of getting this vaccine are great. It protects you and even people without chronic underlying conditions, even younger individuals are suffering from severe consequences or long-term consequences of COVID-19. So we all should try to avoid this. Now, of course, for those who are older individuals, those with chronic underlying conditions, it's most important that they get their booster, but we all should try to avoid getting this infection for ourselves, for our loved ones, for our community. So the benefits of getting vaccinated are great. It is the way out of this pandemic. Side effects of this vaccine are very few. Sore arm, might feel a little under the weather for 24 hours or so after you get the vaccine. But for the most part, these vaccines are well tolerated. Very, very few severe side effects. But the misinformation that's out there, as I mentioned before, is really what's driving a lot of the fear. So there still are people out there that believe that the vaccine will impact their fertility. That's just not true. There's not a feasible mechanism for the vaccine to impact fertility or for it to impact development of children or for pregnant women, that it might impact their children. In fact, that's one of the biggest pieces of information that's really putting pregnant women and their children at risk. All the misinformation that it puts a microchip in your body, again, that just isn't true, but there are many people who do believe the misinformation. So, we try to point people to credible websites, credible information, pointing people to their trusted healthcare providers can really make a big difference when people are on the fence. We encourage people to ask the questions that they have, and not just discuss them with others who might be having the same fears, but really to talk to people about their concerns. At the end of the day, we believe so strongly that the pros of getting this vaccine far outweigh any negatives, again, which are very, very few.
Thank you.
You're welcome.
Our next question will come from Tim Mastro from Delaware State News.
Hi, everyone.
Hi, Tim.
I also had a question about schools. Are you pleased with the amount of people who have enrolled in that voluntary testing program where you get tested each week? And I believe there's never been a week where there's been more than 500 in-person contagious cases, according to the dashboard. Are you just pleased with that number so far? Where do you think the state is at so far with schools?
Yeah, I think we've had our experience in schools has been good in terms of the number of cases. I think the most important thing, Tim, is that we haven't seen spread in schools, and I'll turn over to Dr. Rattay to talk about that. But I think that's the biggest fear and the biggest challenge and the biggest rationale to continue to have our students wearing masks while in school, because we know they're in very close contact to one another. But schools are highly regulated environments, in the classrooms. They have some, movement from classroom to classroom and the lunchroom and that kind of thing that aren't as rigidly regulated as, kind of the other times and spaces. But so far, I think it's been a really good experience. We'd like to see more of the younger people vaccinated. That's been going slower, I think, than we'd like. But in terms of the case, we've seen very little spread in schools. Dr. Rattay, would you?
Yeah, I don't have a lot to add to that. I mean, I think we're really very pleased with how everything has gone with schools this year. We know it's been stressful for everyone involved, especially our amazing school nurses in Delaware. But we have, as I mentioned earlier, our highest case rates for the last few months have been among that school age population, but we've seen almost no spread in schools. As the governor said, we really do attribute that to mask wearing in schools. So we know that is making a difference. We also, though, we do know that testing, specifically testing of unvaccinated individuals, can make a huge difference. Although people seem to be getting, the kids may be coming positive at home or other gatherings, other settings, this school testing can really help identify those who are positive to prevent the spread. And we do think that is helping. We'd love to see enrollment higher in the testing program, but we really are pleased how it has been going so far. And I have to add, as the governor did too, the more and more kids that get vaccinated, the less testing that will be needed in schools.
Mm-hmm. Right. And Governor, you kind of mentioned how the wearing a mask or not wearing a mask has almost become a political statement. Do you also feel that way with some people refusing the vaccine? Has that provided any difficulty with vaccination rates in any specific areas? And is there anything you can do to bridge that gap when you have a situation like that?
Yeah, I think so. I mean, it's hard to say. There is some correlation between, the objection to mask wearing and the things that we're doing more generally, kind of from a political perspective, and vaccination rates. Although the the demographic, both, all over the state that has the lowest vaccination rates. We can put that slide up for you if you'd like to see it again, is that young adult, like 18 to 35-year-olds. So they hover around 50% or lower. And that's not the one with all the sub-age groups. There you go. They're lower in Kent and Sussex County. And I think, part of it is kind of addressing the concerns where they are. I mean, if it's going to be some kind of statement or not, that's going to be hard to deal with. But if we can get to some of these misconceptions, some of these myths around vaccination and its effects. But overall, our vaccination rates are pretty high. They're higher the older you get. Maybe those of us who are older understand our vulnerability. I was a young adult at one point in time too, and nobody likes to be told what to do. And we feel like we're invincible. I think that's part of it. And so I think that's, the psychology of it is interesting. And I think our challenge is to figure out the best way to get people to the point of saying, yeah, I'm going to get a shot, protect myself and protect loved ones around me.
Our last question comes from DJ from WDEL.
I don't know, DJ, you might be muted.
My apologies. You'd think I'd be used to this by this point. You've seen the surge last winter and the new fears and variants that are causing cases to rise already this year. Do you have an anticipation for what this year will look like? Do you expect it? And I know, Dr. Rattay, we talked a little bit about the Omicron variant, I think, a couple of weeks ago. Do you have an anticipation for how that will impact this year's rise in cases?
I'm going to let Dr. Rattay address that, but if we can look at the hospitalization graph again and show, that surge. I was hoping that September surge, that little bump that you see there, and we started to go down more gradually than last December, January, that we would continue to go down. And now that we've seen it as we've gotten into December, and a somewhat predictable, I guess, after the Thanksgiving holidays, and we're trending the wrong direction. I would have hoped that we would continue to head down, but I think it's hard to predict. I can tell you what I'd like to see happen, which is that to peak right there where we are at 296 and start going down the other way. Dr. Rattay, why don't you put a scientific analysis of that question?
Well, there's a couple points. One is we're going to struggle to get out of this pandemic if we don't get more people vaccinated, fully vaccinated and boosted. We know this. And while we've made great progress with vaccination, I mean, it's worth celebrating the fact that our death rate has slowed so significantly compared to last year. But being able to stop these hospitalizations and really getting us out of the pandemic surges that were the roller coaster that we're in, as the governor described, is going to require more people getting fully vaccinated and more people getting boosted. As far as Omicron goes, there just are a lot of unknowns still, and I don't want to get ahead of the science. Again, we just don't know how transmissible this will be, how severe this will be, how effective the vaccine will be. But we do believe that the current vaccinations will do a lot to be able to prevent especially hospitalization and death when we begin to see spread of Omicron here in our state. So again, lots of unknowns, but that is a point that many in the field are very confident of. So the bottom line is the more and more people that can get fully vaccinated and boosted, the more quickly we're going to be able to really get ourselves out of this pandemic.
So I think that was the last question, unless you had another one, DJ.
I did, yes, sir. Dr. Rattay, would it be fair to say that getting vaccinated removes some of the avenue for variants to find a way to evolve? And not to beat a dead horse, but a point that you've mentioned a couple of times now is, and Governor, convincing people who have read and believe misinformation to get vaccinated. Is there a portion of the population that you simply write off? Because I see some of the comments that we get on stories when we cover this, and some of the things that people say are outrageous. How do you convince people that public health experts are not trying to put microchips in them?
Yeah, and I think to your first point, it's a really good question. The virus finds a foothold in unvaccinated populations. And if you look at Omicron in South Africa, many unvaccinated individuals. So the more the virus spreads, the more opportunity for mutations there are. And so, that's a key piece of why more people need to get vaccinated for us to get out of this pandemic situation we're in, because we are going to continue to see mutations and potentially serious mutations of this variant, of this virus, if it continues to have so many opportunities to spread. So getting more people vaccinated will help decrease future mutations of this virus.
Yeah, DJ, I mean, I think you've put your finger on really our biggest challenge, right? Which is to get people that, are acting with misinformation, really bad information. In some cases, it's just maybe an excuse to not to do what's being recommended. But that's our challenge, and we can't give up. We've got to continue to try to find a way to get people to kind of do the right thing. Sometimes it works by showing the surge that we're seeing there, but sometimes it works by it has to work. I know that I've had friends that were resisting getting vaccinated, and then it really impacted because somebody close tested positive, and then their son or daughter couldn't participate in a particular sporting event, or maybe it's somebody who you're close to, who you've seen has passed away. We're just going to have to continue to lean in and try to find the way, meet people where they are, get them to do the right thing, so we can get out of this and prevent and limit the foothold that virus and the variants find and to create surges down the road. I think that's our challenge. We'll continue to be at it. We've made progress through each of these surges, and this one looks a little bit different. It is similar in the sense that these are the winter months. These are celebrations. People tend to let their guard down a little bit. That's why we wanted to get out and share the information, make sure everybody's paying attention to where the positivity rates are, where the number of new cases are, where the hospitalization rates are. One of the really good things, one of the positive things Dr. Rattay said, and I think a lot of it is because our vaccination rates are high, is that the fatalities rates have slowed considerably. Sadly, though, still 2,203 Delawareans have succumbed to COVID-19. That's a very sad thing for them and their families and friends, and that's something we want to avoid for all Delawareans, and we want to avoid another surge that seems to be on the offing here as we look at the data for December 7th. And I guess it's really appropriate to recognize, as we close out the 80th anniversary of Pearl Harbor, so many Americans who gave their lives and sacrificed during 80 years ago, during World War II, the greatest generation, I don't know that we'll ever see again a generation that came up during the Depression and served during the war and the aftermath of that. And you think about the sacrifices that they made, the things that we're asking our citizens to do now in terms of wearing a mask and getting vaccinated are just de minimis by comparison. And so let's all be patriotic. Let's support our city and our state and our country. Get vaccinated, get boosted, protect your neighbors by wearing a mask when you're in an indoor crowded place. Thanks very much for joining us, and we'll see you next time.